Hello, my name is Yvonne Ferguson, and I'm Program Leader at the NIH Common Fund. And welcome to the Technical Assistance Pre-Application Webinar for RFA RM 23012, the Community Partnerships to Advance Science for Society, or ComPASS programs, Health Equity Research Hubs. We are delighted that you're joining us today. Next slide. The Health Equity Research Hubs funding announcement that will be discussed today is an initiative within the ComPASS program. So before we discuss the specifics of the funding opportunity, I would like to start by walking you through today's agenda. Next slide. The agenda for today's webinar is presented here. First, we will introduce you to the ComPASS leadership team and webinar panelists. Next, we will provide an overview of the NIH Common Fund program. Then we'll move into an overview of ComPASS and the initiatives, followed by the Health Equity Research Hubs, which is the focus of today's webinar. We will discuss how the applications will be reviewed, discuss the eligibility criteria, the budget, and the letter of intent. We'll then talk a little bit about the UC2 mechanism, and we'll end with an opportunity for questions and answers. It is our hope that at the conclusion of today's webinar, you will have enough information to prepare your application for submission. Next slide. ComPASS is truly an NIH-wide effort. We want to acknowledge the over 40 NIH staff members representing over 20 institutes, centers, and offices that comprise the ComPASS Working Group. The working group have been pivotal in helping to develop the ComPASS program and the related funding opportunities. So we want to thank them for their efforts. Next slide. The ComPASS Working Group is guided by the strategic insights and vision of the 4 co-chairs listed here. They are Dr. Janine Austin Clayton, Associate Director for Research on Women's Health and Director of the Office of Research on Women's Health. Dr. Joshua Gordon, Director of the National Institute of Mental Health. Dr. Eliseo Perez-Estable, Director of the National Institute on Minority Health and Health Disparities. And Dr. Shannon Zink, Director of the National Institute of Nursing Research. Next slide. Today, we have a great lineup of panelists to highlight various elements of ComPASS with a focus on the Health Equity Research Hubs. We have Dr. Allison Brown, one of the working group coordinators and program director of at the National Heart, Lung, and Blood Institute. Dr. Brenda Ajay, a co-lead of the Hub's working group and program director at the National Cancer Institute. Dr. Amanda Acevedo, a member of the Hub Working Group and also a program director at the National Cancer Institute. And also Dr. Jessica Bellinger from the Center for Scientific Review, and Sean Hine, Deputy Chief Grants Management Officer for the National Cancer Institute. Next slide. Before we provide you with more details about the opportunity, I want to provide an overview of the NIH Common Fund. The NIH Common Fund is under the Office of the Director and managed in partnership with the NIH institutes and centers. These programs are designed to address emerging scientific opportunities and pressing challenges in biomedical and behavioral research that no single NIH institute or center can address on its own, but are of high priority for the NIH as a whole. Common Fund programs accelerate emerging science, enhance the biomedical research workforce, remove research roadblocks, and support high-risk, high-reward science. Now that we've covered the background of the NIH Common Fund, I will now turn it over to Allison Brown, who will highlight the ComPASS program and its 3 initiatives. Allison?
Thank you, Yvonne, and welcome to everyone. In this segment of the webinar, I'll review the goals, initiatives, and activities of ComPASS. Next slide. So what is ComPASS? The ComPASS program has a keen focus on health equity, and it also leverages structural interventions and multi-sectoral partnerships. It's innovative through its focus on community-led research that will intervene on social determinants of health to achieve its goals of improving the health outcomes of communities, reducing health disparities, and changing and informing systems, policies, and practices to advance health equity for all. Next slide. So the overall goals of ComPASS are twofold. First, to catalyze, deploy, and evaluate community-led health equity structural interventions that leverage partnerships across multiple sectors to reduce health disparities. And secondly, to develop a new health equity research model for community-led multi-sectoral structural intervention research across not only NIH, but other federal agencies. And the intention of these goals will be to be carried out in partnership with multiple sectors, including community organizations, federal agencies, businesses, and local and state governments. Next slide. So the planned budget for the ComPASS program is approximately $153 million over the next 5 years, which will fund up to 25 community-led structural interventions. It will also fund 1 coordination center and up to 5 health equity research hubs beginning in fiscal year 2024. And overall, this significant investment highlights the NIH's commitment to addressing health disparities and advancing health equity. So there are 3 key initiatives that are comprising of the ComPASS program. So the community-led health equity structural interventions, also known as CHESIs, they will develop, implement, assess, and disseminate these community-led health equity structural interventions that are co-created in partnership with research organizations. And these interventions will intervene on structural factors that produce and perpetuate health disparities. Then we have the ComPASS Coordination Center, which will lead overall program management and coordination of the administrative, data, capacity building, partnerships, and training, as well as the National Health Equity Research Assembly activities, also known as the HERA. And lastly, we have the Health Equity Research Hubs, which are the focus of today's webinar, and as mentioned, will be funded in fiscal year 2024. So with that, I'll pass the floor over to Brenda. Brenda?
Thank you, Allison, and hello, everyone. In this segment of the webinar, I will provide an overview of the Health Equity Research Hubs, or the Hubs as we refer to them. Next slide. The purpose of the Hubs is to serve as a centralized research resource, providing tailored scientific, technical, and collaborative support for sustainable community engagement, research capacity building, and training to assign CHESI projects that address the social determinants of health and structural factors to improve health outcomes. Next slide. The Hubs will play a critical role in the implementation and dissemination phases of the CHESI projects. Together with their CHESI partners and coordination center, Hubs will employ strategies that are responsive and adapted to the needs of the CHESI projects and the diverse communities they serve. Phase 2 will be from years 3 through 8, and during this phase, scientific support will focus on implementation of the structural interventions. These interventions will influence health outcomes across multiple health conditions and diseases. The final phase of ComPASS, phase 3, will cover years 9 through 10 and will be dedicated to assessment, dissemination, and sustainability for the structural interventions. Next slide. I would like to highlight a few key features of the Hubs as a centralized resource. Hubs will apply a health equity lens across all activities. This requires intentional efforts across all research phases. Hubs will utilize a continuum of community-engaged research approaches and strategies. Each hub will support 4 to 6 assigned CHESI projects and connect them to a wide range of scientific and technical resources. Hub assignment of CHESI projects will be based on thematically organized SDOH and structural factors, which may include nutrition and food environment, community healthcare access and quality, and social and cultural contexts. The Hubs will play a dual role. They will work with their assigned CHESI projects to enhance the scientific rigor of their structural interventions and extend the work of the Coordination Center by providing localized and tailored support. This synergy will enable the Hubs to provide and leverage expertise from within and outside the ComPASS program and establish the Hub as an accessible, valuable, and trustworthy research resource. The Multidisciplinary Expert Panel, or MEP, are central to the Hubs. This panel of core subject matter experts will ensure that the Hub provides ongoing scientific input, guidance, and adds value across all Hub activities. And finally, a scholars program will be embedded to increase the pipeline of mentored community engagement and health equity scholars. Next slide. The hubs will be comprised of at least 4 units. The administrative and coordinating unit will provide overall leadership, expertise, and organizational infrastructure to support the entire scope of hub activities. This unit will establish and engage a multidisciplinary expert panel or the MEP, as previously referenced. The research methods and data management unit will collaborate with the assigned CHESI projects to provide tailored scientific support and intervention-related technical guidance throughout the research process. The research capacity and training unit will coordinate, design, and deliver tailored research and training support for assigned CHESI projects in collaboration with the ComPASS Coordination Center, and the Community Engagement and Health Equity Practice Unit will facilitate and assess meaningful community engagement, research collaboration, and community translation. And this unit will administer the SEEK Scholars Program. My colleague, Dr. Amanda Acevedo, and I will provide a little bit more information about these units and their functions in the subsequent slides, beginning with the administrative and coordinating unit. Next slide. So here are some of the key functions of the administrative and coordinating unit. Please note that these elements are not exhaustive. You should refer to the NOFO for a complete list of the expectations for this unit. But among these functions, the administrative and coordinating unit will provide leadership, administrative infrastructure, management, and operational support, identify, establish, and coordinate the MEP to provide integrated, synergistic, and responsive infrastructure, develop a plan for engaging assigned CHESI projects and relevant partners, develop a hub-specific health equity logic model and assessment plan, and collaborate with the ComPASS Coordination Center to ensure efficient, timely, and responsive coordination, communication, and reporting of ComPASS activities. I will now pass it to my colleague, Dr. Acevedo, to walk you through the rest of the hub units. Next slide.
Thank you, Brenda, and hello, everyone. As Brenda noted, the hub functions delineated here are not an exhaustive list. They are intended, however, to communicate that the hubs play a dual role in their work with their assigned CHESI projects and ComPASS Coordination Center. Under the Research Methods and Data Management Unit, examples of CHESI project-specific support functions will focus on 1, study design, where hubs will develop, modify, and/or adapt study design, monitoring plans, and strategies to measure outcomes. Secondly, on intervention implementation, where hubs will support intervention implementation and apply effective approaches to reach, recruit, engage, and retain participants. Thirdly, data management, where hubs will support data handling processes to ensure harmonization across CHESI projects. Next, on data analysis and interpretation, for which hubs will develop, expand, and apply statistical analysis plans using a health equity lens and processes to promote data justice. And also research dissemination, where hubs will assist with data submission requirements and dissemination of research results to community members, multi-sectoral partners, and other audiences. Next slide. Hubs will also collaborate with the ComPASS Coordination Center in this unit to support implementation of systematic data collection and management procedures for assigned CHESI projects and hub-generated data. It will support standardization of common data elements, including harmonization and interoperability processes. Create and implement an infrastructure for data collection on cross-hub activities to assess effectiveness in supporting CHESI projects. Develop and implement processes to support quality control of all data. Assist with dissemination and accessibility of research information, and monitor and manage security for hub-generated data. Next slide. Next is the Research Capacity Building and Training Unit. Based on needs identified throughout the planning, implementation, and assessment phases of the CHESI projects, Each hub will support and collaborate with their assigned CHESI projects to develop, adapt, implement, and assess research capacity building and training plans based on prior assessments, cultivate and enhance CHESI partners and team members' skills to enhance sustainability of assigned CHESI projects, and establish and facilitate local learning communities or models to connect multidisciplinary partners. Hubs will also coordinate and collaborate with the ComPASS Coordination Center to contribute to development and evaluation of research capacity building and training needs assessments, assist in development of tailored resources, trainings, and curricula, and ensure all trainings and curricula are available and accessible to diverse audiences. Next slide. Next is the Community Engagement and Health Equity Practice Unit. Activities conducted within this unit will seek to ensure sustainability of community-led interventions. For example, the hubs will work with their assigned CHESI projects to co-develop, collect, and assess metrics and measures of community engagement, health equity, and partnership effectiveness. Implement and disseminate effective and culturally relevant community outreach strategies and resources, as well as design, implement, and assess a mentored community engagement and health equity, or SEEK, scholars program. The hubs will also coordinate and collaborate with the ComPASS Coordination Center to contribute to cross-hub activities that advance the science and practice of community engagement in research, facilitate networking, engagement, synergy, and resource sharing among the SEEK Scholars Program, and expand common data elements that capture community engagement and health equity practice indicators. I will now briefly highlight 2 additional requirements for all applications, which are milestones and data sharing. Next slide. I want to highlight these 2 additional requirements for all applications submitted in response to this notice of funding opportunity. So milestones are intermediate steps toward the completion of concrete goals. Applications must include clearly specified and well-defined milestones. These milestones will be used to evaluate the application not only in peer review, but also in considering future funding for awarded projects. Milestones should be limited in number and represent significant accomplishments that inform go, no-go decision points, along with timelines for assessing progress. Data management and sharing plans are also required for all applications. NIH requires all applicants planning to generate scientific data to prepare a data management and sharing, or DMS, plan that describes how the data generated from the project will be managed and shared. For additional information on the data management and sharing plan, visit sharing.nih.gov, where you can locate NOT-OD-21-014 that provides elements of an NIH data management sharing plan. Now that we have provided a description of the 4 hub units and additional requirements, I will now pass it back to Brenda to discuss eligibility, budget, and letter of intent details for this RFA. Next slide.
Thank you, Amanda. In this segment, I will briefly review the elements that you discussed. Next slide. There are a few eligibility criteria that we would like to mention. Eligible institutions that can apply to the Hubs RFA include higher education institutions, nonprofits other than institutions of higher education, for-profit organizations, local governments, or U.S. territories of the federal government. There are also a few institutions that are ineligible to apply for this opportunity: non-domestic, non-U.S. entities, non-domestic components of U.S. organizations, or foreign components as defined in the NIH grants policy statement. Next slide. The budget for your proposed application should reflect the resources needed to perform the duties of the hub as outlined in the RFA. The NIH Common Fund, or the office under the Office of Strategic Coordination, intends to commit approximately $3.75 million in FY 2024. and $7.5 million per year for FY25 through 28 for approximately 5 awards. This amount is contingent upon NIH appropriations and submission of a sufficient number of meritorious applications. You must submit base budget estimates for all years, including budgets for staff or personnel, including the MEP, biostatistical, or other scientific support. Budgets must also include in-person travel costs for the Hub program directors, PIs, key personnel, and SEEK scholars to attend annual ComPASS consortium meetings. Please see the funding opportunity for additional budget details. Lastly, your initial project period should not exceed 5 years. Next slide. Although a letter of intent is not required, is not binding, and does not enter into the review of a subsequent application, the information that it contains allows IC staff to estimate the potential review workload and plan for the review. So we encourage you to submit an LOI, and if you do decide to submit one, please include the descriptive title for the proposed hub, the name, addresses, telephone numbers of the program directors and PIs, names of other key personnel, participating institutions, and the number and title of this funding opportunity. The LOI is due by email 30 days prior to the application deadline to cfcompass@od.nih.gov. My colleague, Dr. Jessica Bellinger, will now discuss the criteria that will be used to assess scientific merit of applications submitted in response to this RFA. Next slide.
Thank you, Brenda. In this portion of the webinar, I will discuss the review criteria for this Notice of Funding Opportunity, the RFA RM 23012 for the hubs. Next slide. The Center for Scientific Review, or CSR, is the gateway for NIH grant applications and their review for scientific merit. CSR's mission is to see that NIH grant applications receive fair, independent, expert, and timely scientific reviews, free from inappropriate influences. After submission, applications undergo a rigorous 2-stage review. The first level is carried out primarily by non-federal scientists with relevant scientific expertise, and the second is performed by advisory councils or boards. While CSR handles the review of applications, CSR does not award funding. Final funding decisions are made by the IC directors in consultation with program officials. Next slide. So how does the process work? It begins with the applicant. On the applicant's part, it is important to read the announcement carefully, pay particular attention to the deadline and review criteria. Plan to submit the application in advance of the deadline. After receipt of an application, referral staff at CSR will assess the application for completeness and will then assign the application to a review group as well as an IC for funding consideration. Program staff will assess applications for responsiveness. The Scientific Review Officer, or SRO, will assemble a panel of expert reviewers to conduct the review of scientific and technical merit of the applications. Next slide. Specific to this RFA, CSR will convene a special emphasis panel or a SEP for applications submitted by the deadline. Applicants do not need to provide study section suggestions, as all applications will be reviewed in the special emphasis panel. Again, read the announcement carefully and follow instructions to prepare and submit the application. Important dates are highlighted in the announcement.
The deadline is October 31st of 2023.
With peer review the following spring, advisory council in May 2024, and an earliest start date for project in July of 2024. The SRO will release the summary statements within 30 business days of the meeting. All applications will receive a summary statement, which includes scores for the review criteria, critiques from the assigned reviewers, as well as any administrative notes. If an application is deemed to be of the highest scientific and technical merit, based on the preliminary overall impact scores and is discussed, the summary statement will also include a final composite score and a summary of the discussion itself written by the SRO. Next slide. Before highlighting the review criteria, I want to reiterate that CSR's mission is to see that NIH grant applications receive fair, independent, expert, and timely reviews, free from any inappropriate influences. Confidentiality is a key aspect of the integrity of the peer review process. Reviewers are instructed to treat review materials and the meeting proceedings as confidential. Likewise, applicants should not communicate directly with any reviewers about an application. There's no expiration date on confidentiality. Applicants should direct review questions to the SRO. The assigned program official will be listed on the summary statement and is the best point of contact for questions about next steps. Next slide. Applications submitted to the NIH in support of the NIH mission are evaluated for scientific and technical merit through the peer review system. Only the review criteria described in Section 5 of the announcement are considered in the review. These criteria should be read carefully as the application is prepared. The reviewers will use the NIH 9-point scoring scale from 1 as exceptional to 9 as poor to provide criterion scores for each of the 5 scored review criteria. The overall impact score is based on the criterion scores using the NIH scoring scale of 1 through 9. Equal weight does not need to be given to each criterion. The overall score is not an average of the scored criteria. Next slide. In Section 5 of the RFA, the review criteria are detailed, including those specific to the hub application. Read the announcement carefully and pay particular attention to the review criteria. For each of the criterion, the application should address and the reviewers will evaluate both the general and NOFO specific questions. The full list is available in Section 5, but here are some highlights. For the significance criterion, does the project address an important problem or critical barrier to progress in the field? Specific to this RFA, the application should also address the extent to which successful completion of the aims contribute to or complement community-led efforts to design and implement structural interventions that advance health equity. For the investigators criterion, are the team members well suited for their roles? For multiple PI projects, do the investigators have complementary and integrated expertise? Specific to this RFA, do the PIs demonstrate experience managing complex team science research with populations experiencing health disparities? For the innovation criterion, what's novel about the project's engagement strategies, methods, theoretical concepts, or interventions? And specific to this RFA, what is the likelihood that resources generated by the hub will be innovative and ready for rapid uptake by other hubs or components of the ComPASS program? Next slide. For the approach criterion, Are the overall strategy, methodologies, and analyses well-reasoned and appropriate? And specific to this RFA, how feasible and appropriate is the Hub's proposed approach to support the implementation of community-led health equity structural intervention? And finally, the environment criterion. Will the scientific environment contribute to the success of the project? The overall impact score is based on the criterion scores, again, using the NIH scoring scale of 1 through 9. Additional review criteria will be evaluated as appropriate, such as the study timeline for applications involving clinical trials and the protections for human subjects. But reviewers will not give separate scores for these additional items. Next slide. There are many resources available to assist in preparing a grant application or to learn more about the NIH peer review process. ERA Commons is where the applicant can check the status of the application or track its progress. The ERA Service Desk is available if there are any problems with a submission. Again, plan to submit early. And CSR has many resources about the peer review process, including an inside look at peer review, as well as tips for preparing application. Now I will turn it over to my colleague, Sean Hine, to discuss the aspects of the UC2 mechanism. Next slide.
Thank you, Dr. Bellinger. This RFA utilizes the UC2 mechanism, which is a cooperative resource-related research project. I'll be discussing the core elements of the UC2 mechanism. Next slide. The hubs will be using a cooperative agreement mechanism. A cooperative agreement is used when there will be substantial federal scientific or programmatic involvement, which is the case for this initiative. Substantial involvement means that post-award, NIH scientific or program staff will assist, guide, coordinate, or participate in project activities. The NIH staff will support and stimulate the awardee's activities. They will not assume direction, prime responsibility, or have a dominant role. Next slide, please. The UC2 mechanism is used to support high-impact ideas through cooperative agreements that may lay the foundation for new fields of investigation. It is also used to foster new approaches to improve the interactions among multi- and interdisciplinary research teams, advance the research enterprise in a way that could stimulate future growth and investments, and advance public health and healthcare delivery. In addition, this mechanism can propose the creation of a unique infrastructure resource designed to accelerate scientific progress in the future. Next slide, please. A complete list of terms and conditions can be found in Section 6 of the RFA. Here are some highlights. The PI will provide scientific leadership and administrative oversight for all aspects of the hub, adhere to the NIH policies regarding intellectual property and data security and release, establish reporting timelines and provide periodic reports and data in a timely fashion and standard format, participate in CCC coordinated and cross-hub collaborative and governance-related activities. The NIH project scientist will serve as the NIH scientific representative to the investigators under the policies and procedures of the cooperative agreement, provide substantial NIH scientific and programmatic involvement, work closely with the PO and ComPASS awardees to maximize progress toward the program goals. There will be one PS for each hub. And the NIH program officer will provide scientific and programmatic stewardship, including monitoring progress and compliance with general policies and regulations, approve annual milestones and any significant changes to the award, provide technical assistance to correct performance and facilitate interactions, make funding recommendations, including award restrictions based on progress. And with that, I will turn it to Dr. Yvonne Ferguson to provide guidance on how to submit your questions. Next slide, please.
Thank you, Sean. We now welcome you to submit your questions to the email address provided on this slide, which is cfcompass@od.nih.gov. We also encourage you to look at the frequently asked questions on the ComPASS website for additional guidance at www.commonfund.nih.gov/ComPASS. Thank you for attending this webinar. We wish you the best in developing and submitting your application.